Good afternoon, and thank you again for continuing to fulfil this public service communications role. When we started these daily updates, the forecast number of deaths, if we had taken no action, struck terror into us all. We are protecting lives, and we are protecting the National Health Service. Families across Northern Ireland have stayed at home and helped to flatten the curve, but be in no doubt, this is not the time to take our foot off the pedal or indeed return to our pre-COVID-19 routines. We must stay the course of isolation and social distancing. Those of us in government are working very hard to map out a path to recovery to support every part of society, but the recovery will be graduated one step at a time, importantly taken at the right time. By taking one step at a time, we can protect lives, we can protect our health service, and also, importantly, protect your family incomes. We will work together as an executive to achieve this. The Agriculture Minister has reopened forest parks today with additional important controls in place. He has taken this step after careful consideration, and the parks under his control will be open for people who live nearby, and the car parks will remain closed, and there will be no picnics permitted. Now, I appreciate the impact that staying at home can have on mental health. We want to enable people to have a space to clear their head and to get some fresh air, but any abuse of this will not be tolerated. Earlier today, I had a wonderful visit to Dugan Contracts in Bangor, who are working in partnership with AG Electrical to manufacture face visors for NHS staff. It was a fantastic opportunity to meet employers who are putting people ahead of profits. All across Northern Ireland, there are companies giving freely of their time to make PPE for frontline staff, and we have talked about many of those companies during our press briefings. Collectively, we say a huge thank you. For those of you concerned about the connectivity of Northern Ireland throughout and on the other side of this crisis, be assured we understand your worries and are working with Her Majesty's Government to ensure that our connectivity by road, sea and air is safeguarded so that freight can continue to move in and out of Northern Ireland. For our tourism, hospitality and retail sector, we hear your voice and we are continuing to work to seek to assist. In all of this, our actions must be sensible. We are not out of the woods, nor would we seek to make a dash for the exit. To do so would be foolish and to risk a second wave, which would undo all of the good work which we have collectively been involved in over this last few weeks. And while it is sensible for the public and private sector to be considering how we reboot, we must not lose sight of our primary focus to flatten the curve of this pandemic and to follow the public health advice. All of us need to think about what society may look like when restrictions are gradually lifted and how it will function. The global economy has taken a huge hit as a result of COVID-19, a hit that will have long-term implications for the way the public and private sectors operate for years to come. But we must all face the reality that when the initial threat recedes and the first wave of this pandemic is over, it will not be business as usual. Everyone in a position of responsibility in the public and private sector need to prepare for a new normal by asking questions such as, can I facilitate remote working among my employees? Are there technological solutions we have introduced to the way we do business during the crisis that are working and could continue once the initial COVID-19 threat recedes? And are there creative ways to keep production lines going whilst guaranteeing the safety of our workers? Can shift patterns be altered over the course of a week to meet the safety needs of employers and also the demands of our customers? Those are questions we're all going to have to wrestle with over the next coming months. Before I hand over to the Deputy First Minister, I wanted to give a brief update on the business grant schemes. And in respect of the 25,000 scheme, which, as you know, just opened yesterday, there have already been 2,096 applicants. In relation to the £10,000 scheme, that has had 19,138 applicants, 16,033 338 has been paid to date, and a further 655 of those will be paid today. Michelle.
Thanks, Arlene, and good afternoon, everyone. I want to begin again today by acknowledging all those who have lost their battle to COVID-19. And very sadly, I can confirm today that 9 people have died as a result of the disease. So on behalf of the Executive, I send our heartfelt sympathies to all those who have lost a loved one. I begin each day by recognising all those people that have died, because I think it's important that we all keep each and every one of us, all those individuals, to the forefront of our minds. All those lives lost are the tragic reminder to all of us about why we're doing what we're doing during these unprecedented times. We in government, our frontline workers, and all of you at home are part of one huge single effort to protect each other and to save lives. The Health Minister spoke yesterday to our local modelling on this pandemic. The most up-to-date modelling has shown that some 1,500 people could lose their lives as a result of coronavirus in the first 20 weeks of the pandemic. Those figures are still shocking and they're still harrowing, but they are a significant reduction in the figure that we were talking about and fearing from the very outset of the pandemic. But you have to remind yourself why that is so. The reduction is because of you. It's because of your actions, and those actions have saved thousands of lives. By staying at home and following the restrictions, observing social distancing, washing your hands, you have slowed the spread of COVID-19. You directly have spurred our health service from an unimaginable burden. You have protected our frontline workers. You have saved lives, and you should all be very, very proud of that. These are tough times for everyone, and I know that there are people right across our society who are finding it particularly difficult. Please remember that this won't last forever. We should all look forward to a time when we can come back together with our families, with our friends, to live our lives, to visit each other, and to celebrate as we choose. And that time will come. But for now, and for the foreseeable future, we must not forget that COVID-19 is still here. To do so will be catastrophic for our people. Even though we can't see it, COVID-19 is still present in our communities. It's still spreading, and it's still killing people. We cannot allow complacency to creep in. It's as important now as it was last week or last month that we keep following the public health advice. We all have to collectively shoulder the burden in the fight back against this virus. We're all in this together, and we all have to get through it together. Thank you.
Our First Minister, Deputy First Minister Mark Devonport, BBC Northern Ireland. I want to go to the issue of cemetery closures, which appears to have divided the parties on the executive. First Minister, we've heard from the DUP that it supports a controlled reopening of the cemeteries. Whilst that might be well-intentioned given the anguish that many people face, isn't there a danger that if that happens, without a big battery of contact tracers in place and a more effective testing regime, that we risk the potential of a second surge of this disease? And Deputy First Minister, Sinn Féin are saying, look, this is a price worth paying. It's necessary, even though it's very tough. Given the tales of anguish that we've had, a pensioner trying to climb over the gates of a graveyard in Cullybackey, people protesting outside Derry City Cemetery, isn't the concern that you might actually lose part of the population who would like to obey these regulations but find themselves in such very difficult personal circumstances?
Thanks, Mark, for that question. And this is a very difficult issue because we want to send out very clear messages, but I do fully recognise, I think we all fully recognise and sympathise with the many distressed constituents who have made contact right across the political spectrum, who have not been able to maintain graves or visit graves as a result of the regulations. And much has been said about the negative impact on lockdown on people's mental health and anguish. And I think that this is a very good example of that. You see, we're not just dealing with the direct harm caused by COVID-19, and we come here every day and talk about the number of lives lost to that. But we also have to acknowledge the wider harm that is going on in society as a result of COVID-19 to other issues, and this is one of those issues. So we will be having further discussions around this issue at the Executive. The regulations are in place. In order to allow this to happen, the regulations will have to be changed. Therefore, we will have to come to a collective decision on that issue. My view is clear. I think we should allow, in very controlled circumstances, limiting the visiting hours and making sure that social distancing is in place. However, I do recognise that other colleagues have justifiable concerns around that, and I think it is important that we continue to have those discussions.
So I think that the first thing to say is that I think we all recognise the sensitivities and the fact that it's a very emotive issue for people to want to be able to visit their loved one's grave. And I know many people personally who take great comfort in that. But we are still in the middle of a pandemic. Yesterday, 90 people across this island lost their lives. Today, in the last 24 hours here in the north, 9 people lost their lives. We're not out the other side of this yet, so we have to focus very much on the public health message, which is to stay at home and only go out if you need to. So despite all the sensitivities, which we fully understand, we all listen to people, we all engage with people, we all talk to people who are feeling this right now, because we know what people are being asked to do is, it's quite difficult. It's so hard for people right now to be able to maintain the measures which they've been asked to do. But this is for the public interest. This is for to do right by people and to save lives. And I can assure the public at home and anybody out there who feels anxious about this issue, as soon as we're in a position to be able to lift the restrictions, and that's what we will do. But ultimately, this is still about saving lives, and that has to be the number one overriding priority in all of this.
Good afternoon. Hi, it's Vicky Hawthorne from UTV here. A question for both First Minister and Deputy First Minister. You'll probably be aware, I'm sure, of the large drop in attendances at our emergency departments and concerns about cancer diagnosis and things like that not being picked up in the current lockdown. Is there now a concern, a fear that the lockdown, the restrictions that the public are now under could inadvertently cause more deaths than the virus itself in Northern Ireland? And also you, First Minister, you mentioned on Friday about a meeting with the head of the civil service about a kind of recovery plan, and albeit you're reluctant to talk about the future so much, you have hinted about what the future could look like for the economy there in what you've just said. Can you give some details on the plans that are being made and any details of that around the economy and plans for the future?
Well, in terms of the last part of your question, Vicky, I think it's important that we are criteria-led and not calendar-led, that we look at the advice that we are giving from our own scientific advisory group on the mainland, and of course our own Chief Medical Officer, and that we move when the time is right. But of course, one doesn't just move immediately. You have to have plans made in respect of recovery and renewal, and it is of course right that we should be talking about those plans, but of course we're not at the point where those plans will be able to be put into place. In terms of the first part of your question, this is a matter which I am concerned about. In other words, non-COVID healthcare. It is vitally important that people present at hospital if they are unwell. I heard from Brian Gallen, who's a stroke specialist in my own hospital, in the South West Acute Hospital. He's very concerned that people are not presenting with stroke symptoms. And of course, the South West Acute Hospital is an excellent hospital and has a very good turnaround time in terms of dealing with strokes, and he is concerned that people are not presenting. And I think it is very important that we send out a very strong message that if you feel unwell, you definitely should attend hospital or GP. And indeed, we recognise that there are non-COVID healthcare issues that we will need to discuss with the Health Minister, and it's an ongoing issue, Vicky, and one that I am concerned about.
I suppose, Vicky, we need to take this platform again to drive home the message that if people are unwell, if people are feeling any of those symptoms, then they need to go and use our emergency departments. They need to go to their GP if their child is unwell. Those services are still available to the public. I think it's probably testimony to the people here in the society that we have. The people were very fearful about how the health service was going to cope throughout this period, for obvious reasons and for all the fears that we all had. But our services are there to help people, and people need to use them. And we would join with the Health Minister in making sure that people hear that message loud and clear. No one should sit at home if they have symptoms of heart problems, or if they have stroke symptoms, if their child is unwell, they need to go and seek medical attention. And just in terms of the issue of plans for recovery, we are still in the crisis. We are still in the public health crisis, and that's what our focus needs to be. But clearly we as an executive have to plan for what comes down the line, and that's what we continue to do. But now the message the public at home need to have and need to hear is that we're asking people to keep doing what you're doing, because look, we are having a very positive influence on what the outcomes are, and we're bringing down the number of people who've actually lost their lives.
Hi, First Minister, Deputy First Minister, David Young here from PA Media. I know we've talked about this before to a degree, but in regard to the different approaches taken by different councils on different issues, we have recycling centres open, as you know, in one council area. We have certain council areas who closed parks from the outset, some that kept the parks open from the outset, some that are now reopening them. There appears to be a real danger of mixed messages in this regard in terms of the council actions. So what can the executive do, notwithstanding the autonomy local councils have, but is there anything more the executive can do to try and get some sort of joined up approach on all these issues and even enforce some of these issues if need be? And just a secondary point to the Deputy First Minister, I'm sure she's aware today in the Assembly, Jim Allister accused her of misleading the House in regard to the much talked about PPE order for China. So just her response to that, if you wouldn't mind.
Well, in terms of the liaison between ourselves and local government, we do that through the Chief Executive Group, which is called SOLAS, with local government, and we have been speaking to them on a regular basis. They're part of our Civil Contingencies Group, which meets every morning. Councils are autonomous, and therefore in terms of their remit, they can make those decisions. I think it is important that we try and get a joined up approach, and to that end the Agriculture Minister is bringing a paper to the Executive very soon on principles around the disposal of waste. We will have that discussion and then share that with colleagues in local councils, so we hope that we can achieve that joined up measure in a more meaningful way. But it is important that people, as I've said during my remarks, have the time to clear their head, have the time to have exercise. And I think for some people, I live in a wonderful part of the world, as you know, David, in County Fermanagh. There's plenty of space and plenty of green fields. That's not always the case for everybody that lives in Northern Ireland, and I recognise that.
But I think the principal point of consistency of message is really, really important in terms of the public health message. So we will get this paper that's coming forward, and we'll be able to discuss it as an executive. But I think that we all have to be guided by the public health message and the advice that's given. On the comments made today in the Assembly, let me say this very clearly. I stand over every word that I said in the Assembly chamber on the 23rd of March. And if Jim Allister wants to repeat his comments outside the privilege of the chamber, then I'll take any step that's necessary to vindicate my position. I think just on an aside to that, I think that by and large, I'd say the majority of MLAs have been very constructive, very supportive in trying to work our way through this. But there's a few, like Jim, who like to just petty political point score. But sure, that's his prerogative. My job is to save lives.
Good afternoon, Nigel Gould, Downtown Radio and Cool FM. I would like just to get back to the lockdown measures, if that's okay. Yesterday, the Chief Medical Officer said it was premature to say we are through the worst of the crisis. Assuming you both agree with that, when do you anticipate we will see this, and what does worst case scenario look like? And the second part of my question is, do you foresee a time at this stage when lockdown measures could actually be potentially increased? Or are these as strict as we'll get?
Well, throughout all of this, Nigel, we have been led by the Chief Medical Officer and indeed the scientific group in London in terms of what the best evidence is to move forward upon. They have been giving us advice as to when we move in to the measures that we have now. And again, when we take the steps to come out of the measures that we're currently involved in, we will be taking his advice. So it was very interesting to hear him speak about that yesterday. We have our own Northern Ireland modelling now, which is very important because then that allows us to make very much our own decisions here in Northern Ireland, and that is being updated on an ongoing basis, led by Professor Ian Young. So we will be acting based on the science, which I think is very important.
Yeah, it's important that we're guided through this, Nigel, by that scientific advice and what's in the best interest of people. We obviously have that number one priority of saving lives, so it's what we do, making sure we do it at the right time and making sure that we protect people as best that we can. You asked if this is as tough as it gets. We're in an unforeseen circumstance, so what we've said to people is that, or an unknown circumstance, none of us have ever been here before. So I think it's important that we let the public know on an ongoing basis why we're doing what we're doing, why we're asking people to stay apart. And I think we've communicated that message well. I think by and large the wider society out there understand why we're doing what we're doing. We seem to be able to get through this and be able to cope, albeit in the most challenging of circumstances, and our frontline healthcare workers just have to be commended to the high hilt for the work that they have done. But we can assure the public that as we come through this and we see what happens next, we have to continue to look at the modelling and see what happens next. But any measure we take will always be with the objective of saving lives, and nothing will be done that's not necessary to be done, given that they are quite stringent measures.
Thank you.
Thank you.